Guys, so this week for our week 6 technology challenge, we were asked to just kind of talk about some of our best learning moments in this course and how we envision using the technology learned about to enhance our own teaching. So prior to this course, I knew that it was important to include technology while teaching our patients. However, after this course, I realized just how much technology is available to help teach our patients. Technology such as virtual field trips and Glockster assignments are things that I quite honestly did not know existed prior to this course. And I definitely think that they'd be beneficial to my students because they're exciting, they're interactive, and it's a way of integrating technology into the learning environment so that the students are creating. They're not just sitting there listening to the professor talking at them. Realistically, PowerPoints should be a thing of the past. Um, we shouldn't be sitting there just lecturing our students. It should be more interactive. So using technologies such as the ones we learned about in this course will be very beneficial. So additionally, I thought it was beneficial to observe a simulation. So I was lucky enough during my undergrad to participate in simulations each year, as well as during the nurse residency program. However, after these many courses about nursing education, I realized just how much I was able to grow and stuff since participating in the simulations myself. So I additionally had never heard about big data prior to this course, and I think that it's definitely an important topic for nurse educators to know about because ultimately this will help lead to patient change, and as an educator, we are at the forefront of change. We are considered leaders, and big data will help get change for our patients. So overall, I feel that some of my best learning moments for this course were developing the critical thinking skills to be able to think through technology myself. So as a student right now, I know the frustrations of not being able to get technology to work properly, and I'll be able to remember this feeling for when my students are struggling, and I'll now have the tools to be able to help them figure out things as well. So how do I plan on using this technology in the future? So as I mentioned before, PowerPoint really should not be used that often. We should really be getting our students involved and active, critically thinking. All the research shows that patients learn better by doing and making than they do by listening. So it's important to get them participating fully in order to help them become better nurses, which will help them provide better care to their patients. So I'm just excited to include as much technology as possible that they will use in the clinical practice. I think it's important that students learn about what's being used in practice prior to getting there so they aren't shocked and they're able to focus on the so many other things that they have to learn as a new grad. So as a clinical educator, I plan on focusing a lot of my time on that for my students so that they feel more comfortable once they graduate. So thank you for listening and enjoy the last week of this class. Bye.